you ever had the experience of sitting in a doctor's surgery feeling a bit anxious, maybe even a little hopeful of a solution, only to walk out with a prescription, maybe a pamphlet, but still no real answers? Maybe you've been told your blood sugar is creeping upwards, your blood pressure is a little high, or your cholesterol isn't where it should be. The advice is usually quick, well-meaning, but often feels like it barely scratches the surface. Take this tablet, watch your diet, and I'll see you again in 6 months. And my name is Dr. Nerys Frater. I'm a GP here in West Wales, and for years I've worked both in the NHS and doing lifestyle medicine, and I want to share with you why I started my clinic, how I see problems and solutions differently, and how a different perspective might help you make progress with your chronic health condition. And here's why I believe so many people feel stuck, frustrated, and even a little bit let down by the standard advice they receive. Because let's be honest, modern medicine is incredibly good at what it does best. If you break a bone, have an infection, or need urgent care, the system is second to none. But what about those long-term health challenges? What about high blood pressure, type 2 diabetes, high cholesterol, those slow-burning issues that seem to creep in as the years go by? I spend roughly 70 to 80% of my time as a GP treating people with these conditions within my work as an NHS GP. And here's the thing, these conditions are often treated as isolated events. High blood pressure, there's a guideline for that. High cholesterol, another guideline. High blood sugar, a different set of rules and medications. But what if I told you that these aren't really separate problems? Not only are they linked, but if you really looked at the root cause, in the majority of people, they actually have the same root cause. And if you think about it, it may be relevant to you, a friend or a relative. Have you noticed how so many people have all of these together? High blood pressure, cholesterol and diabetes, maybe heart problems at the same time. So when my outlook difference from that of modern medicine is this: I see a diagnosis of high blood pressure as a symptom, not a standalone condition. I see high blood sugar, as you see in type 2 diabetes, as another symptom, not necessarily a standalone disease. I see them as warning signs of something else. Warning lights, if you like, flashing on the dashboard of your car or your body. So imagine actually if you're driving your car and the engine warning light comes on. You instantly see this as a sign that there's something wrong in the car. You might not know what, because the next step would be to work out what is wrong. The last thing you would do is just stick a bit of tape over the light or focus on getting rid of the light without working out why it came on. You'd ask, what's really going on in the engine or underneath the bonnet? What's causing this light to flash in the first place? And that's the approach we take in lifestyle medicine. Instead of just medicating the warning lights, trying to dim them, we look to see what the problem is. We ask, why is your blood pressure high? Why is the blood sugar rising? Why is your cholesterol out of range? And this is not about blame. It's not about saying you've done anything wrong. It's about getting curious and understanding the root cause. Modern medicine has become far too obsessed on treating the warning lights with tablets or injections, and none of these medications ever aim to cure the problem. We only aim to manage the problem. So what does that mean? It means that a tablet for high blood pressure is meant to be lifelong, because the assumption is that the high blood pressure will remain with you for life. Especially seen if you take the medication away, your blood pressure would rise back up. And as we doctors know, it's also quite likely to get the reading to get higher and higher, requiring more medication on top. But here's where it gets really fascinating. So often the seemingly separate issues, high blood sugar, blood pressure, cholesterol, even things like fatty liver, can be traced back to the same common thread. In medicine, we call this metabolic syndrome. We've known that they're linked for some time. It's a pattern we definitely see again and again in surgery. One person, multiple warning lights, all connected by one underlying change in the way the body handles energy, insulin and fat. But there is no tablet that treats everything in one go. This is why our guidelines remain focused on one disease or one warning light at a time. So let's shift this. What is the root cause of the metabolic syndrome? You might have heard of insulin resistance. It's become a bit of a buzzword, but it's at the heart of this story. When your body becomes less sensitive to insulin, your blood sugar rises. But that's not all. Insulin resistance can also drive up blood pressure, affect cholesterol levels, contribute to fatty liver, heart attacks and strokes. It is like a domino effect where one thing leads to another, another and another. But the way our healthcare system is set up, each of these gets its own tablet, a pill for the blood sugar, another for blood pressure, another for cholesterol. And you might find yourself, or somebody you love, on a whole list of medications, each one managing a symptom, but none of them really addressing that root cause. But please don't get me wrong, medications are and can be life-saving and absolutely necessary. I prescribe them myself every day. But what I want you to see is that tablets manage chronic disease. They don't cure them. They help keep the warning lights from flashing too brightly, but they don't fix what's happening underneath the bonnet. And that's where my approach to the lifestyle clinic is different. Instead of focusing on each warning light in isolation, we look at the whole car. We look at you, the whole person. We ask, what is driving these changes? Because whilst the answer is not in medication, it is often found within our lifestyle, the way we live day to day, the effects of modern living. So is it stress? Is it sleep? Is it the way your body processes food? Is it years of small habits adding up over time? And most importantly, what can we do to turn things around at the source? Because this is the exciting part. When you address that one thing, the root cause, when you start making changes to the way you eat, move, rest, and manage stress, you don't just put a tape over the warning lights. You start to see them switch off one by one. And there is no tablet that does this. There is no prescription that fixes everything at once. But lifestyle medicine, when done right, can. And contrary to popular belief, it can happen quite quickly as well. And you know what? I know you might be disappointed to think that the solution might involve another diet because you've tried them before. You've cut out sugar. You've joined slimming clubs, counted calories, and still ended up back where it started. And I get it. So many of the people I work with have been there too. They've followed the advice. They've tried to do everything right and still felt like it just wasn't enough. And often people feel like they've just failed. But it isn't your fault. Most advice out there is generic, focused on surface changes, eat less, move more, take this pill. It rarely asks why your body is struggling in the first place. It rarely looks at your life, your habits, your stress, your sleep, your unique challenges and strengths. What I want you to know is that you don't have to feel frustrated or powerless anymore. In fact, what this really means is that you have so much more control than you've ever been told. You don't have to feel at the mercy of your GP or left in the dark about what's happening inside your own body, feeling frustrated with the healthcare system. I want to give you that power and understanding back, because the truth is there is real potential, even to come off medication you've been on for years. I've seen it. I've helped people. Since 2018, in fact, I've been running programs teaching people how to get their bodies working better. It's not about counting calories. It's not about going to the gym or working yourself to the ground. It's learning how to decrease insulin resistance and inflammation. Once you start to master this, and honestly you can begin to see changes in just a few short weeks, you can expect to see the kind of results that I see all the time in my clinic, which is 1 in 3 people reversing their diabetes, blood pressure coming down, weight dropping, joint pain improving, energy returning, brain fog lifting, so many things, and they're real outcomes, and they're absolutely possible for everybody. This is my life's work now, showing people that you are not stuck and you're not broken. Your body is capable of healing and thriving when you give it what it needs. And you don't have to figure it out all alone. And if this does resonate with you, if you're ready to understand how lifestyle medicine can work for you, how you can start reading these hazard lights in your body and take back control, I want you to get results. And I've created a free health breakthrough video series, which is open for everybody. I've created it to guide you through the steps to get started, to give you hope, show you exactly how you can achieve these changes for yourself. So make sure you click the link to receive access, and I'll see you again. Thank you.